All right, ji. Assalamu alaikum, everyone, for joining today for a very important topic on healthcare systems, their current status in Pakistan, and what is the way forward. Under the pandemic, certainly these systems have been tested very thoroughly, I believe, and their quality, patient safety, many aspects of the again healthcare system has been, I would say, battle tested. This is the right time to start with again having some of our panelists here, some experts from the healthcare industry, and we will be today asking them what to do. First, they will critically analyze what has happened, and in terms of the status of the current system pre and during the pandemic, what are their views? We will begin asking them, and eventually we will be moving towards sort of a building an agenda of future for healthcare managers, what we can do. Uh, I will start with my introduction. I'm Dr. Rameez Khalid. I am heading the Center for Executive Education at IBA, and this center has been doing it. It has been like a decade that we are now in healthcare management systems. The initial program was designed by Dr. Kidwai, who is here, and Dr. Hashmi is with us as well. I will eventually, then when they will be starting speaking, I will request them to introduce themselves as well. Uh, for a very brief introduction, Dr. Minhaj Kidwai has been the director of the healthcare management program at IBA. He has been the CEO of the Sindh Healthcare Commission. Uh, that commission basically started under his leadership. Then we have Dr. Uzair Hashmi. He is an independent consultant in the healthcare industry, very renowned, and he is very pivotal for many hospitals and healthcare systems for the revival in terms of operational excellence. Uh, for me, I will start speaking about this program that we have at IBA, which is a healthcare management program, and we have tremendous, I would say, response from the industry. Many renowned institutions have been sending their doctors and dentists and anybody who's in the healthcare profession, maybe quality managers as well, to this program at IBA. Uh, and this webinar is also sort of a starting point, I would say, for more programs. If there will be a thorough response, something we will be again seeing through again your questions, because there is a Q&A section at the end of this uh, webinar. So that will give us some sort of a homework to do, something to do with that. I have been myself doing audits with Sindh Healthcare Commission, inspections with Healthcare Commission. So I have myself assessed very renowned names in Karachi, majorly private hospitals. So my personal area is again quality management and operations management. So in terms of operations, there is a lot we can do, certainly, and continuous improvement and Kaizen is life. Uh, Whoever again continuously improves can certainly survive. And in our healthcare system, survival is like our duty, right? Survival to help people survive is our duty. Without again further ado, I will now move to my panelists. And the first round they will be speaking about after their introduction is the as a scenario, the current status, where we are at the moment, their critical analysis of the situation. And they will be speaking again about any aspect of the system, whether it be quality, whether it be patient safety, whether it be infection control, many other systems, maybe inventory management and warehousing can come into play as well. So I will start with Dr. Minhaj Kidwai, and then once he will speak about again, speak his mind out, then certainly we'll move to Dr. Hashmi. Thank you, Dr. Kidwai.
Thank you, Ramesh, and assalamu alaikum, everybody, and good afternoon or good evening, good night, wherever you are. It's a great opportunity for IBA to start such kind of discussion and dialogue and discourse where we can exactly elaborate that what are the issues in terms of the healthcare, not only healthcare, but health management, which is my close to my heart, basically, is very much neglected in terms of overall its own incorporation into the system, because health fundamentally is defined as a state of physical, mental, or social well-being, and later on some also people added to the spiritual well-being as far as the definition of health is concerned. But when we talk about the health systems, basically health systems comprises of the people, the institutions, and the delivery that of the services that takes place through the health system. But the most important part of the health system is what we are trying to achieve through the health system. The goals are basically for the prevention of the diseases, promoting of health, and at the same time the treatment or the management of the health. Now, there we touch upon the health management aspect, where we traditionally believe that doctors that will be managing health, but doctors they are trained basically to manage the patients, their body, and their systems in terms of the bodily system. So this is a medical or clinical model of the health management. Unfortunately, the doctors are not taught in terms of their own teaching undergrad level for the health management aspect. This is the medicinal model, clinical model I'm talking about. But at the same time, there are other models also, like public health is also a teaching model. And apart from public health, the social medical model, or the even bio psycho social model. So there are a lot of models that have been in practice in terms of teaching purposes, but mostly we try to train our doctors in terms of the clinical management of a person. Unfortunately, the health management aspect is neglected in this case. So I've been a strong proponent of putting the health management as an undergraduate teaching aspect, and I'll push that further later on. But at the same time, once we are talking about the health service deliveries and services, the most important aspect of the service delivery is the financing of these services that comes place. And when we talk about the financing, there are different models of financing that takes place on a global basis. We have the UK model, the German model, we have the US model, and we have the French and the Canadian model also. So those are the basic health system models that have we have financing. Unfortunately for Pakistan, when we talk about the health financing, it's mostly the private sector which takes care of the 80% of the patient population, which is the out of pocket from the patients, and 20% is from the public health system. But we have seen in terms of the service being provided, that it's not only the doctors that are considered as the service providers, but in our practice that we have seen, especially in terms of the service delivery is concerned, that even to the aspect that shopkeepers service delivery are also involved, where they sell different medicines at our shops. In terms of even pan walas, they sell these medicines. So in terms of selling medicines, then we have these street dentists that provide these dental facilities at these streets. And we sometimes we see this ophthalmologist who are giving this eye testing at the roadside. Unfortunately, the health system in Pakistan is not that much regulated. where we have the quacks flourishing within the system, more than about 80 lakhs of health providers in terms of the quackery that goes on in the system. So we have these quacks also providing services, and in fact, the people, they sometimes love the quacks because they are more cost effective, they are more economical, and they are near to their home also. So it's easily accessible, 24-hour service available for them. So in my experience that I have seen, that the quackery flourishes because the community is being served better by these quacks, rather than I'm myself being a clinician, I know, and a service provider, that we would like to propagate the right type of health services by the clinicians and ourselves. But unfortunately, somehow these quacks flourish within our society. And because the system is unregulated, we have been able to establish the health commissions in Punjab for the first one, and then followed by KPK and Sindh, and followed by the Islamabad Regulatory Authority, so establishment. So we have taken these initiatives in terms of the regulation, because we want to know to exactly establish the healthcare quality by developing standards and making and ensuring that people follow those standards. Therefore, it's quite a long way to go, that the quality improvement that we talk, because it's a process of continuous improvement that we talk about, definition of quality. So system has been there, but unfortunately the roadblocks have been also there at the same time, in terms of moving forward, in terms of the regulation of the system and implementation of the healthcare quality standards that we would like. Unfortunately, there are issues, there are problems that we are facing these challenges. And these things came forward in terms of when we are dealing with COVID at the moment, where the health system was exposed to COVID. Fortunately, we were able to deal with the COVID in terms of Pakistan being one of the 7 countries that has been able to curb COVID. But touch wood, thanks God, that we have been able to do good for this. But the system's challenges are there, and we need managers to manage the system. And these managers should ensure that the quality is ensured at the healthcare facility, and quality enforcement leads to patient safety, which is the bottom line. So I would just close this thing, that definitely there are health systems available, things are there, but the quality has to be improved, and we need to focus on patient safety. And for this, we need good quality managers through different teaching institutions. That is the role academic that has to play. Thank you.
Thank you, Dr. Kidwai. Dr. Hashmi, please, what is in your mind in terms of the as is?
Ji, thank you, Dr. Rameez and Dr. Kidwai. As Dr. Rameez, Assalamu alaikum to everybody, of course. As Dr. Rameez very kindly said, my firm, we do consulting for the healthcare sector, the delivery sector, and we come across a number of consumer end issues. Not consumers are not only the patients, but for the healthcare service, they are the hospitals themselves. उनके अपने issues होते हैं और वो सब. And when you talk about quality and prevailing quality, unfortunately, we try to convince ourselves कि यार इसके लिए पैसे नहीं हैं और इसके लिए फंडिंग नहीं है और ये क्वालिटी करेंगे तो हमारी इनकम गिर जाएगी. फॉर प्रॉफिट वाले में वो उनका ख्याल है कि क्वालिटी इक्वेट्स टू एक्स्ट्रा एक्सपेंडिचर. एंड जो पब्लिक सेक्टर है वो कहते हैं क्वालिटी मीन्स कि हम कम लोगों को वो भी खर्च हमारा बढ़ जाएगा तो कम लोग बेनिफिट करेंगे. वेयर इज actually it's a matter of looking at this situation and turning it on its head and creating a win-win. And I think having had taught continuously at IBA for the past few years. I'm involved in other places also, namely College of Physicians and Surgeons and other private universities. So primarily healthcare management की जो need है, I think that is growing, and if anything can come out of the corona disruption is the realization that there is a massive need for proper management in hospitals. जैसे डॉक्टर किदवाई साहब ने भी बोला शुरू में कि जी वो हॉस्पिटल्स में मैनेजमेंट एज सच प्रोफेशनल नहीं होती है. गुड न्यूज इज देयर आल्सो फॉर डॉक्टर्स. ऐसी बात नहीं है कि व्हेन यू टॉक अबाउट प्रोफेशनल मैनेजमेंट यू से कि यार डॉक्टर नहीं कर सकता, एक एमबीए को ले आओ, ऐसा नहीं है. And actually, worldwide, there have been studies which have proven, especially for the hospital sector, that people with a clinical background, when they get formal management training, turn out to be better managers. And I think that is what IBA and most of the other places are also doing. And that is a great thing that is happening for the last few years. This year, I think, that the potential employers have also come to realize कि ये अब हमें करना चाहिए और करना पड़ेगा. मैं बहुत छोटे से एग्जांपल, डॉक्टर रमीज ने शुरू में इन्वेंट्रीज की बात की, मैं दो छोटे से एग्जांपल्स आप लोगों को एफिकेसी के बारे में मैं बात करना चाह रहा हूँ, और व्हाई वी नीड मैनेजर्स. आई नो हॉस्पिटल्स, clients, large hospitals who were smart enough to order masks and these things late last year, not because of the pandemic, but as a standard practice. वो ऑर्डर ही 6-6 महीने के करते थे. तो जब उनके पास स्टॉक पड़ा हुआ था, तो इस शहर में हम सबको पता है कि मास्क की कीमत कहां से कहां चली गई. That client of mine did not pay a rupee over what he paid for a wholesale purchase of 30, 40,000, 50,000 masks a few months back. Secondly, we've been involved with ERP implementations also in large hospitals. The amount of money a hospital can save actually, whether it is a public sector hospital that says कि यार हम charge तो नहीं करते, but I look at it from the point of view आप उसी 100 रुपए में एक के बजाय 2 लोगों को दवा दे सकते हैं अगर आप अपनी इन्वेंट्रीज एफिशिएंटली मैनेज करें. From a private sector perspective, you can make more profit. And you know how the inventories are managed, we all know, and these things are there. The whole gambit is there of management. I think it is a virgin management field as far as Pakistan is concerned. And I think IBA initiative is excellent. It provides a doctor or a medically oriented person, pharmacist, physiotherapist, whatever, with a launch pad to enter the management cadre in healthcare. And the need, like I said, the people who think they don't need it today, maybe 6 months from today or 2 years from today, you will start to realize, they will start to realize that we are already late. The concept, logon ko, they have to wrap their heads around it. Management doesn't mean increased cost or lesser profit. In fact, if anything, it means the exact opposite. It means either reduced cost or increased profit. तो मैं इस एंगल से इसलिए बात कर रहा हूँ कि when we go into hospitals, practically speaking, उनके जो owners होते हैं, उनके जो boards होते हैं, वो दो ही चीज में से एक चीज को देख रहे होते हैं. या तो वो कहते हैं जी हमें प्रॉफिट ज्यादा चाहिए, या वो कहते हैं कि हमारी कॉस्ट बहुत हो गई. तो मैं इसको इसलिए कर रहा हूँ कि दे जज, अगर आप उनको इन दोनों में से किसी एक चीज पे कन्विंस नहीं कर सकते, then they will never go for professional management. I always feel that one of the major reasons for lack of professional management in our public and private setup is this fear that either the cost will increase or we will lose profitability. So, we can talk about lack of quality in our system. Yes, it is there. I mean, nobody would deny it. But I think I would always look at it in a positive light. मेरा ये ख्याल है कि जो कोरोना पेंडेमिक हुआ है, इससे बहुत सारे हॉस्पिटल्स जो शायद आज से 1 साल पहले कभी सोचते भी नहीं क्वालिटी ऑफ मेडिकल ट्रीटमेंट को इम्प्रूव करने के लिए या मॉनिटर करने के लिए या अपने हेल्थ केयर वर्कर की हेल्थ को मॉनिटर करने के लिए, आई थिंक टुडे दे आर राइटली मोर कंसर्न. And definitely, even if some of them sort of wean off this behavior, I think it will last a very long time, for a very long time to come in the minds of the management also. So that is my really initial sense on this. Over to you, Doctor.
Thank you, Dr. Hashmi. To reinforce again more and more about the state of affairs today. Certainly there are positives and certainly there are what we call opportunities. Rather than calling them as again gaps, we should again more consider them as white spaces. So in terms of opportunities, Pakistan is again gold mine. So and certainly why not the healthcare sector? So we can do many things in terms of improving and ameliorating the whole system. So again, reinforcing that particular aspect, I will go back to Dr. Kidwai, and I will ask before going on to again a discussion on the to be side, the current state of affairs. I would like to ask you about the quality of the human resource we have in the healthcare sector, and more we want to listen from you about uh, outside the hospital. Like for example, what is the quality of human resource in the hospital, and certainly emphasizing in terms of in clinics and in the whole healthcare system, if we can again enlarge it. Thank you.
Thank you, Ramesh. I think I'll pick on what was said earlier by Zair, that the need for the health managers in the industry is quite extensive. I can quote one example that out of 16 people in healthcare industry in US who provide care for a single patient, uh, 10 people are managing his case. So that is something that could be translated into our industry also, that we not only have to manage the patient in terms of clinical management, but at the same time, there are a lot of things that are going at the back end of the patient that we have to focus on in terms of management. And what Ramesh said in terms of the supply chain management, medical management, uh, appointment management, and administrative management. There's so many things that have to be managed. So patient management is not only a clinical management, it has to be coupled with good quality medical managers who are employed in the industry. But there is dearth of these qualified medical managers in Pakistan, I would say that, because the quality improvement and quality focused hospitals are very few in Pakistan. We can name Shaukat Khanam, we can name AKU, we can name Shifa, and some others who may be in process. So the lack of quality definitely should not be deterrent for the people to join hands in terms of the aspect of health management. And when we are talking about health management, it's basically we are looking at the quality management of the patient. And these quality management is focused on the standards that we develop for the hospitals, and not only for the hospitals. I would say that these standards should be applied in the same way in terms of the clinics and the clinical management, and at the same time in terms of we have other practices also like hakims, homeopaths. So all those service providers who are providing services, they should ensure that their clinical setup is managed by standards that they have to follow. And then to implement those quality standards, I think we need quality managers to make sure that the quality aspect of the patient management, because it's important when we are providing clinical care to a patient, the bottom line is patient safety. And that cannot be ensured before without having a quality setup in place within the system. So that is important that the clinical managers are trained enough in terms of quality management, and these standards are taken up as a Bible, I would say that, because the health management is something that is very rare in terms of practicing over here. And let me tell you that back in '96, I started the program in IOBeam in health management. And from there onwards, several other programs were started. And then we also have some programs back in uh, nationally also. But still, there's a lot of requirement for training more health managers in the country who can implement these quality standards at the clinical settings. But at the same time, these standards are the first step, because ultimately we have to move forward from these standards into another level of set of standards, which we call as accreditation. Unfortunately, Pakistan does not have accreditation bodies established over here, and we have to rely on international accreditation bodies for that purpose. So not only we have room for quality standards set up, but we also have a room for the accreditation bodies to be established in Pakistan, where the hospitals can be accredited at a quality level, and this will help these hospitals to improve their profitability. As Uzair said earlier, that quality term does not mean that we are increasing cost. Quality is there to improve the profitability of the hospital. Initially, it may look like that we are putting the cost and elevating the expenses, but at the same time, when we are looking on a long-term basis, we will be increasing our profitability on a overall basis. So sometimes it becomes a deterrent for people to spend some money in terms of quality improvement. But when it is spent in a planned and a structured way, I would say that this is the way that where the health managers come into play, and they have to play their role. But we have less institutions to train these kind of people, and I think that IBA can take lead in developing such kind of platform.
Thank you, uh, Dr. Hashmi. In terms of state of affairs, what is the state in terms of waste management in the industry, in the healthcare industry?
You have, I guess, elected to unleash the hornet's nest. Um, it is obviously, from my reaction itself, you will realize, and our participants, I'm sure, also all of them, we have nearly 40 people watching. They will know from their own personal experiences. They are obviously connected to healthcare in one way, form or the other. Um, State of healthcare waste management is obviously not brilliant. When I started my consulting firm about 10 years ago, we spoke to people about it, and then I realized कि हॉस्पिटल्स में जो लोग इसकी जिम्मेदारी जिनको होती है, उनको सिर्फ जो ऑन द जॉब रियलाइजेशन होती है, वो उसी की बेस पर डिसीजन लेते हैं कि वेस्ट कैसे मैनेज होना है, और कोई उनका वो नहीं है. तो पहले तो मैंने अपने ऊपर वो रूल अप्लाई किया, एंड आई गॉट सर्टिफाइड फ्रॉम द यूएस ऑन हेल्थ वेस्ट मैनेजमेंट. Because there's no point in me talking to anybody if I really don't know what I'm talking about. And then we set out, and I must say, one should be very fair. Punjab mein health waste management is miles ahead of Sindh. I can assure you, I have visited, I have personally observed the collection and handling of waste from the ward bed up to the point it has been thrown in the incinerator. And I have yet to see that kind of record keeping, because one of the primary premises of health waste management is that it should be a chain of custody of the waste should be auditable. और हमारे यहाँ ये चीज़ unfortunately नहीं है. There is a lot of scope in it. Government of Sindh is making efforts, no doubt about it. It has improved. But again, I will come back to the mindset of the people who manage the hospitals. This healthcare waste management really is an organizational culture issue. It is not going to happen in a day. It is not going to happen in a month or a year. But I think the government should also keep on going at it. The hospitals will have to continuously train and retrain their staff. And I think मेरे लिए तो देखिए, मैं अगर किसी अस्पताल में नौकरी करता हूँ, मैं एक नर्स हूँ या एक जूनियर डॉक्टर हूँ और मेरे पास 2 अस्पताल हैं, एक मुझे X अमाउंट ऑफ सैलरी देता है और मुझे X + 10% सैलरी देता है. I would prefer to work in the hospital to बेशक मुझे X दे मगर हेल्थ केयर वेस्ट मैनेज करता हो, प्रिकॉशन लेता हो कि मुझे तो बीमारी ना लगे, मैं अपने घर वालों तक तो कोई कम्युनिकेबल डिजीज या कोई इन्फेक्शियस डिजीज लेके ना जाऊं. So it is also realization, and I think again I will come back to this corona disruption, because I call this a disruption because as Dr. Rameez and Dr. Kidwai know very well, management में वो कहते हैं entrepreneurship में होती ही disruption है. Disruption cause करे जो entrepreneurship वो सबसे ज़्यादा successful होती है. And I think ये अल्लाह ताला की तरफ से एक disruption है. This is a wake-up call to everybody, and this is the time we should be looking to adopt all of these things. State, where if you see, you can count the hospitals who have incinerators on your fingers. There are hardly hospitals that have incinerators. I will not even get into the point of जिनके पास installed हैं वो चल भी रहे हैं या नहीं चल रहे. That is all entirely different, and I think somebody like Dr. Kidwai also may have something to weigh in on that from his experience.
Yeah, definitely. Thank you, Zair, because this is something very close to my heart also in terms of the hospital infections and infection control, because this is very important when we took over the case in terms of the HIV AIDS outbreak in Larkana. And that was one of the main reasons of reuse of syringes that was taking place in Larkana, because that was the main reason. And that struck me because when I saw we are morely focusing on the hospital waste management, which in my term is a misnomer, because not only hospital, it's also clinical waste, and the clinical waste that is being disposed from the clinics, which is being sold, not collected at all. It is being sold by the clinics and the staff that sell these. And then this becomes basically a ground for people to flourish in terms of the mafia that is working in terms of the waste management. So hospital waste management is a misnomer in my opinion. It should be a medical waste management that should cover not only hospitals but also the clinics. And somehow or other, I think the hospital have to play a important role in terms of the waste management, especially with the clinics around their hospitals. If they can set up a system where the clinics management becomes their responsibility in terms of waste, and they can have a good referral source from the clinicians who are clinically practicing in their area, so they can have a symbiotic relationship where they have a relationship with the clinics and they collect their waste and they dispose of their waste in terms of whatever is required. So, as I said, that hospital waste management is a misnomer. It should be taken in terms of medical waste management, and clinics waste should be considered when we are talking about the waste collection and incineration.
Right. Thank you, Dr. Kidwai, Dr. Hashmi. Now we are moving towards a very important agenda, that is, after building the current status as a scenario of the healthcare industry, healthcare sector in Pakistan. Certainly in half an hour, this is the the extent to this extent, certainly we can cover. There are many things to improve, and there are many opportunity areas. Uh, Maybe we will cover them under another heading, which is the to be. What is the to be now? What healthcare managers, especially in Sindh, then nationally, and then maybe globally, we can speak about some of your ideas. We want to again know uh, what should be their homework, what you want them in terms of your tips, your how this system can be improved, an individual effort, an organizational effort. Dr. Hashmi has already spoken about the boards and the top management decision making in terms of cost and financials, etc. So coming to you, Dr. Kidwai, I will start with you and then move on to Dr. Hashmi.
Well, talking about way forward, something which I have seen in the practice throughout in these days, that communication skills is a very important area, and the doctors especially, they hardly give time for the patient to communicate with them, and then that creates a problem where understanding of the issue of the patient, clinical communication in terms of the patient management is quite different in regular management, because doctor-patient relationship is very sacred, and until unless the doctor does not hear the patient properly, and the communication skills is not taught during our clinical practices. So somehow or other, this is a way forward from my side, that those doctors who are practicing clinics and also others, and in fact the health managers, this should be one of the topmost priority to learn communication skills, not only in terms of talking but also in terms of writing, because sometimes we write emails and other information to other people while we are communicating, and we forget that the email requirement is basically we should not be writing with the emotions. So somehow or other, when we are responding to an email in anger, we try to respond same way, and then that becomes a document aspect, and this is important because then that document becomes a legal document. So we do not see the implications of moving forward, because the communication from my perspective is a combination of input, process, outputs, outcome, and impact, which is relating to the attitudes and our behaviors. So way forward from my side in terms of the managers, the topmost priority is the learning of the communication skills. Secondly, the review of all the quality standards that are available. They can adopt them according to their requirement and needs, and they should learn about that what are the improvement areas required in, if people who are practicing they are over here, or even the health managers who want to learn about the quality standards that need to be implemented. And again, for that purposes, I think we need an academic platform where they can come and learn these things. Thank you.
Thank you, Dr. Hashmi. Now, your views on this.
Dr. Kidwai actually touched upon something that I spend at least one session on with my students, which is communication. Because I fully agree with him that the ability to communicate concisely, precisely, and clearly is extremely important. Also, you have to take into point the receiver कि उसकी क्या ability है, और वो भी कभी-कभी हमारे लिए difficulty होती है. But carrying on, Dr. Ramiz का जो primary question है कि how to move forward and what to see for the future, मैं तो advise करूँगा all current and future healthcare managers को who are working in hospitals, who have and hospital owners को भी, go back, take a step back, look at your systems. Don't look at micro day to day. Step back, look at a broader vision. Because situations like pandemic or epidemics, these require broader views. But not only that, broader view of your own institution. I touched upon this earlier. बहुत सिंपल होता है किसी आप हॉस्पिटल में जाएं वो बोले यार वो इतना उनसे आप पूछें आपकी इन्वेंट्री मैनेज हो जाती है कहते हैं हाँ इन्वेंट्री मैनेज हो जाती है हमको इतनी ज्यादा खरीदते नहीं है 5-10 लाख 10 लाख महीने की लेते तो जब आप उनसे बोले आप इसको एक साल पे एक्सट्रापोलेट करें तो सडनली वो 1 करोड़ रुपए क्रॉस कर जाती है एंड देन व्हेन यू टेल देम कि जी इफ यू डू एफिशिएंट इन्वेंट्री मैनेजमेंट you will save 7 to 10% of this amount. वो जब मैथ करते हैं तो देन बिकॉज उससे पहले वो रियलाइज तैयार ही नहीं होते टू स्पेंड ऑन इट सो आई थिंक this is a great opportunity for current and future healthcare managers and hospital administrations to review their systems on a slightly more macro level and then look at where they can bring in more efficiency and effectiveness so that again they either make more money or spend lesser money. But it's a great time for organizational soul searching, if you ask me. That's my message on this.
Right, thank you. So in terms of like I will completely see that systems are becoming more and more important, and both of you have been emphasizing the importance of developing this system, strengthening the system, be it be a quality management system, be it be any other functional system under the whole healthcare system. So I'm myself teaching the healthcare supply chain management courses, and again in my limited assessments of the hospitals, I completely agree with this line of thought, because supply chains are again are combination of processes, and if we put again right processes in the right places with the right KPIs, key performance indicators of those processes, then eventually we will know the health of the whole again system, any system like inventory management system we are running in our hospitals or healthcare systems like clinics even. So moving ahead, I would like to now in terms of Q&A, before moving into Q&A, I would like that you both if you can again share your thoughts about institutionally, like individually, I have noted like communication management skills, quality standards skills, like there are some standards by Sindh Healthcare Commission and some other, again, internationally JCIA, for example. So individually, healthcare managers will be moving towards and exploring these systems and improving their communications and healthcare systems and quality management, quality standards. In terms of institutions, what are your views? Dr. Kitwai, I'll start with you. What are your views? What the institution should do as like a hospital, maybe any other healthcare institute?
Thank you, Ramesh. As far as the academic model, I have my own academic model that I have applied at different places, and that is the REST model, which is research, education, systems, and training. Without research, if you do not have data, you cannot manage. So it's important that you have a baseline data to manage, and definitely quality improvement cannot be done because without data, you cannot manage those things. So it's important that you start with research and then educate people in terms of the areas where they lack, especially the doctors who lack in those areas. I would say marketing is some an area where the doctors do not have training when during their clinical duration. So this is something we can add into the marketing of and then communication skills, as I said earlier, in terms of the educating people. In terms of the systems, I think systems, there are subsystems also that are in place while we're talking of healthcare systems. So these systems would be the information management system that we need to make doctors aware of the information management system in terms of the hospitals and the wherever settings they are working in. And apart from that, We also have the strategic management system where the strategies need to be informed with the doctors. And then the role of leaders in leading a hospital in terms of the management and as a senior person who is leading the whole institution. So leadership is very important to be added and considered as a part of the academic teaching, especially because healthcare is completely different. And when a clinician is asked to lead, he should have these leadership skills in order to go and lead an institution. So from academic perspective, this is important that we involve these aspects. And along with these things, then if we teach something and we do not give them a first-hand knowledge and information, and then apply that knowledge in terms of the specific settings of hospitals. So the hospitals should be there as a laboratory, I would say, for these health managers to go have some kind of a training setup with them, so they can apply those things that they've learned in during their academics, and then have some kind of first-hand knowledge and practical experience in terms of training. So this is something that I would recommend.
Right. Thank you very much. Because certainly technology layer is becoming very much important, and your thought about the ERP or EMR, what we call it, electronic medical reporting systems, or more and more remote patient monitoring systems are coming in. So the technology layer is becoming more and more important. So these information systems have to be in place, and that this should be on the agenda of the strategic management of the organization, of any organization, be it healthcare or any other.
Yeah, let,
Before,
let me
yeah, yeah, please, please.
interrupt you over here, because with this, that also important, the role of telemedicine at the moment, because technology is very much now in use, and we do less use of telemedicine, but telemedicine has to become probably a technology of future in terms of healthcare, because if we train the people who are at the remote level in the villages to exactly examine and have an initial assessment done, where the doctors are sitting at home, or those female doctors who are not working or practicing, they can be utilized for this purpose. So both things can work together in terms of better healthcare, especially in terms of rural settings, because that is very important, where we lack doctors in rural setting, and the reason of thriving of quackery is because of this reason.
Right. Thank you. Before moving on to Dr. Hashmi, I would like to request the audience that they can place their questions in the chat box. So we'll be taking questions from the chat box. Dr. Hashmi, your thoughts about the institutional level homework. Thank you.
Thank you. I think the change or the improvement in healthcare and the improvement in the utilization of formal management techniques in healthcare can only be brought about once institutional leadership is involved. End of the day, you may have the most willing manager, senior, middle manager, who wants to apply management techniques, who wants to bring change, but he will never eventually go against what the senior leadership does. So I think for sure institutions have to, like I said, rethink how they have been doing. And because of all that has happened now, it is also naturally forcing them to rethink how to redefine the rules of business, so as to say. Institutions should actually support their high achievers or potentially high achievers by sponsoring them for management training, because end of the day it is the institution that is going to, how they will ensure whether that person stays in the job and so on is entirely transactional detail between the person and their institution. But end of the day, institutions should themselves encourage. They should try to go towards management and how I should encourage. That's the word I was looking for. They should encourage management. जहाँ तक technology की बात है, तो I will give a couple of examples on that. आप देख लें हमारे यहाँ how many hospitals in Sindh, Pakistan have what is called CPOE, computerized physician order entry system. A lot of hospitals will have billing, will have labs, will have radiology, but CPOE nahi hota. So there are a number of factors for that, cost being one of them. It is not a cheap thing to do. But again, it can become a USP for a hospital. It can give it a marketing edge compared to the other hospitals. So it's again for the leadership to realize, okay, how are we going to leverage this? Because the other aspect of it is the one that perhaps all of us here are more concerned about. It has been proven that if you invest in a CPOE, the rate of medical errors goes down. So again, it is towards patient safety. There are many ways you can skin this cat. Dare I say, the government can have a electronic medical record system that it funds and owns the license to, available free of cost to health centers, because that itself will go a long way in reducing medical errors and so on. So there are many ways you can do this. ये वाली बात जो डॉक्टर किदवाई ने की थी, बिल्कुल सही की थी कि हमारे टेलीमेडिसिन वाली बात जो इन्होंने की थी. And I can tell you, I know hospitals even in the public sector, National Institute of Child Health, Sindh Institute, Urology Transplantation, Indus Hospital, they are all doing a lot of work in telemedicine. And I know NICH does 6 centers in interior of Sindh where once a week they have clinics. पेशेंट और एक डॉक्टर वहां होता है, कंसल्टेंट कराची वाला यहाँ होता है, वो डिफिकल्ट केसेस डिस्कस करते हैं. SIUT भी ये करता है, इंडस भी यही करता है. तो ये they have led the way. I think they have shown the way. Yeah. And it is now for others to figure out how to leverage this information and how to use it for their benefit, and of course for the benefit of the populace. That is very important. End of the day, I think in a lot of times I see when people talk about management, change, bettering things, sometimes they lose focus on who it is all for whom it is. It is eventually for the patient, whether it is a public sector patient or a private sector patient. Public sector patient, तो फिर सरकार ने अपनी जिम्मेदारी पूरी की. Private sector patient, जो CEOs हैं, जो मैनेजमेंट है, वो शेयर होल्डर्स को अपनी जिम्मेदारी पूरी करते हैं when they have a satisfied customer, when you have a customer who gives them repeat business. So both ways, if you look at it, you can look at it very positively. So, that's how I look at it.
Right. Thank you for your input. And certainly this technology layer, as I spoke earlier as well, that it is becoming more and more important. And certainly what you both have emphasized, one of the example was during the floods, and certainly in pandemics, how this technology layer can help us or facilitate us. There can be like another webinar that maybe we can do on only telemedicine. So like OJA and like DUHS did in Badin floods, and when the floods came in Badin, so how they responded there as well. That is another example. Now I'm opening the floor for Q&A. So I'll be asking some of the questions because we have, in terms of time, we have 5 minutes, but we will see maybe 10 minutes extra or something. We will decide in due course. The first question we have. One of the questions that I am getting, and 2-3 people have asked this question. It's like there are many systems, like for example, JCIA or any other quality management system, or under healthcare system, there are many other systems like Dr. Kidwai was speaking about. Or we just take as an example of Sindh Healthcare Commission's service delivery standards, or minimum service delivery standards, MSDS, for example. How to sell these to our top management? Like if there are managers in our audience, they feel like how to sell it. So what are your tips? I will be again giving this question to Dr. Kidwai. Yeah.
Thank you, Ramesh. I think it's very important that the top management is given exposure to these standards, and then the benefits of these standards that may bring in terms of the increase in profitability, even patient safety improvement also, and the people who are working in the system, they have their own issues where they can be addressed through these quality standards, because these standards are focused on entire system of the hospital. So I think if some people can review these standards, and then they can make a presentation to their top management, because until unless leadership is not convinced about these systems, the implementation will not take place. But in order to do so, these people have to comprehend and understand these standards themselves first, before they will be able to send and sell these standards to the top management. In fact, what I initiated earlier was that we signed an MOU with the Pakistan Institute of Management, and under the Pakistan Institute of Management, we ran a course on these standards, and giving exposure to these managers in the hospitals. And then they were able to sell these standards to their respective hospital institutions. So knowledge is power, definitely. Without being knowledgeable on what you want to sell to the customer, the product has to be understood in totality first. So these managers need to understand these standards and what the benefits can be gained out of these standards. So again, uh, knowledge is important.
Thank you. The second question that we are getting is, are we ready for another pandemic? So I'll be posing this question to Dr. Uzair. Are our healthcare systems ready for another pandemic?
Thank you. I'd just like to add, if you don't mind, to the previous question.
Sure, sure.
Dr. Kidwai Saab has very rightly talked about knowledge being the power to convince, but also I understood from your question, you have managers who want to convince their top management to go for these things. तो इसमें जो चीज डॉक्टर किदवाई ने शुरू में एक बोली थी कि लैक ऑफ मार्केटिंग सेंस, वो भी मैं देखता हूँ डॉक्टर्स में अक्सर में कम होता है, सब में नहीं, अक्सर में कम होता है, कम तो नहीं होता बट वो उस एंगल से नहीं देख रहे होते. आई ऑलवेज टेल पीपल कि हमने अभी तक बातें की हैं कि जी दिस विल हेल्प यू, दिस विल ब्रिंग दिस गुड. आई टॉक अबाउट मार्केटिंग में थ्योरी होती है हाइजीन थ्योरी, तो मैं उसको अनहाइजीनिक एंगल से भी बात करता हूँ कि when you have quality, when you have auditability, when you have a culture of where you are concerned about the patient and the quality of healthcare being delivered to the patient, you will save yourself from a lot of the hassles that arise with some patient complaining with a video on Facebook or WhatsApp going around town about your hospital कि जी ये हो गया वो हो गया, and then the hospital realizes कि हमारे पास सारा पेपर वर्क नहीं है, या हमसे ये गलती हो गई, या हमने हायरिंग के टाइम उस बंदे की क्वालिफिकेशन नहीं देख पाए. So when you have management system, it will help you avoid all of these undesirable outcomes also. So you know, that was my first thing. Your question about whether we'll be ready for the pandemic next time, I think that is more of a global question. And इसको मैं flip करके थोड़ा सा पहले आपको present करूंगा कि just because we have not had 200,000 deaths in Pakistan doesn't mean our health system is more advanced than that in the US. So you know, don't think of it like that. We've been lucky. Why we've been lucky, we will come to know in a few months or few years when more in-depth research is done, there are a number of theories and conspiracy theories going on about. So we won't get into that. I think, yes, compared to January this year, today, we as a nation and nearly all other nations on earth are far more aware and far more ready to deal with the pandemic. Because remember, this one came after 102 years. 1918 was the last pandemic. So there was about 3 generations of people, and the current generation said, "यार हमसे तो पिछली generation में भी pandemic नहीं हुई, हमारा क्या होगा?" And you can see that from the point that when Mr. Trump came into power into 4 years ago, 2 years ago, 2 years into his presidency, he disbanded the permanent pandemic team at the White House on the same pretext कि यार ये तो 100 साल में नहीं हुआ, अब कहाँ से हो जाएगा? And we know all what's happened in the US, and the latest news from today is that he and his wife, unfortunately, have also tested positive, and they are isolating and so on. So I think, to answer your question in short, I think yes, we will be better prepared, but that doesn't mean just because we have been exposed to it, we will automatically come better prepared. I think we can exponentially increase our preparedness by looking at the various aspects from a managerial perspective and tackling the issues as and when we identify.
Just adding to what Dr. Zayas just said, I think we are not over with COVID at the moment, and COVID is sometimes looks like a sleeping partner with us, and we don't know when it will be exposed in our body. So that is something probably COVID, we have to live with it and then continue the preventive aspects of the preventive measure that we need to take in terms of COVID. Just share one quick sort of comment from a person that we have interviewed from Pahalwan Got, which is in the east district east of Karachi, which is the most affected area in district east. And his comment was that COVID is not a disease of poor people, because we don't see it and we don't use masks because of that reason. It's more of a disease of an affluent and high structure society where you find more in defense rather than in and in these areas. It has gone now, and that's why we are not taking any preventive measure. So this is something of their perception. Probably they think that Pakistan has gone through the COVID stage and they do not to take any preventive measures, but some other, we will see how it goes onwards.
Right. Thank you. There is another question. Maybe I'll start responding to this question and then open the floor for both of you as well. This question is about explain a financial model in this critical and in this critical situation, as well as forecasting and inventory, and also how to operate to provide good quality of service. It's too much difficult because cases are on the rise. तो इस सवाल का जवाब I will start with it because I teach forecasting, I teach inventory management as well. Dr. Hashmi also again does that. So in terms of like how to provide good service using better inventory management techniques and eventually good forecasting techniques, so that we have access, so that we have ample stock of those medicine and medical supplies that we need in a hospital to run on daily basis. We shouldn't have an excess of these products because in technology sector we have obsolescence, in healthcare sector we have expiry. So due to that and sterilization and many other aspects we need to see in the healthcare setup. So excess is again a big waste. And next is certainly the biggest waste is certainly being stock out. It is more of a fear that we get stock out of a particular stuff. So forecasting plays a very important role, and it becomes a big partner with inventory management. So there are many forecasting techniques, and in our programs, in especially healthcare management programs all around Pakistan, I have seen these courses where we teach forecasting methodologies, and inventory management philosophies, what to use and what not to use. Then last point from my side is in the last 10 years, IBA has developed a baggage of gap analysis tools. And these gap analysis tools can help institutions find their gaps or opportunity areas, whether it be quality side, whether it be service quality side, if very specifically you want to ask. For example, a model is there which is ServQual, which is for service quality, how to gauge your services quality, and healthcare services can be gauged, the quality of their services can be gauged through these models on these lines. I'm opening the floor for Dr. Uzair or Dr. Kidwai to respond to this question in the chat box.
Okay. I'll just give a short thing. I understand it was about the financing of it and how to get financing. So I think, again, you should actually show your management the extra money they spent buying supplies when the pandemic became apparent to everybody. And I gave you an example of one of my clients who had a normal supply chain process and they saved hundreds of thousands of rupees just in masks. So I think you should look at it because senior management जब होती है, चाहे वो public sector हो या private sector हो, end of the day they are paying for something. So you have to look at their perspective and explain it to them in those terms. And you can go back right now, you can do your data, Dr. Kidwai ने बड़ी अच्छी बात की, research, do your research कि जी हमने pandemic में जो चीजें ली और हम normally जो लेते थे उसमें क्या differential निकला. What's the differential? We could have potentially saved all of this had we had a system in place to monitor and supply chain and so on and so forth. Dr. Kidwai, if you would like to add something.
Well, what I would like to add to it that disaster management has not been taught basically in our institutions. And I think this is one of those subjects that should be actively taught, especially considering in terms of the COVID situation. We also had earlier disasters like floods and earthquakes, but somehow that these subjects are not touched in our institutions. So I think this is time probably IB can look into the teaching of disaster management and how these aspects can be considered while we are taking care of the financing or supply chain management, or looking into these areas which we are not exposed to in earlier. But basically, the financing part is very important because those managers who are working in these situations, financial management, because the funds are not there for this particular situation. So funds have to be allocated from other budgets. So they have to look into exactly that where the cuts can be made in terms of financing in these areas where the disasters take place. So it's important that managers are well aware where the financing needs to be done and what is the priority in terms of the budgeting that is done on a yearly basis. And some kind of a step management should be made where the disasters can be planned accordingly in terms of the financing and supply chain management.
All right, thank you. I believe this will be our last or maybe close to the last question because it is difficult to sell all these ideas that we have been discussing for the last hour to our top management. So certainly what the role government has played, we know in terms of Punjab Healthcare Authority or Sindh Healthcare Commission. There are many other bodies and associations that can play as a sort of a pressing group for or realization group, for example, for the whole industry. So what are those associations to both of you? They should play their role to sort of a pressure, again, creating that pressure, peer pressure in the community, in the healthcare community, that these models have to be incorporated. They need to, again, bring this technology there. They need to encourage the word Dr. Uzair used, encourage their again healthcare managers or develop their healthcare managers. So, what are those associations to you that can play their part hand in hand with the government?
Uzair, do you want to start? Should I start?
No, please go ahead. Please.
Acha. When we're talking about the institutions, I think we need to consider that what is considered for the holistic systems improvement. And when we talk about the systems improvement, the systems comprise of three basic pillars, which is the people, institutions, and the service delivery. So I think all these three aspects needs to be considered when we are talking about these programs, where the marketing should be done to the institutions who are academic institutions, at the same time who are the service delivery institutions, and with the people or the management who will be taking part in these courses. But coming back to the institution, what Ramesh, your question is, I think that the private hospital associations is one of the area where we can combine as a stakeholder. Then the pharmaceutical manufacturing or pharmaceutical area where they are directly involved with the healthcare sector, these institutions, and then at the same time the NGOs who are working in health sector, because when we talk about health management, it's not only the hospital managements. Then we have the NGOs and INGOs where these health managers also can go and have some kind of association and good jobs. WHO employs a lot of people and other areas. So I think that when we are considering institutions, the NGOs and INGOs exposure and the private hospital association, the pharmaceutical manufacturing association, these could be the institutions that could be stakeholders, but at the same time, as I said, that the people and the other service delivery aspects in terms of individual hospitals also, which are there, and they are the basic customers. I would say that the IB would be looking for the placement of these people.
Right. If you don't mind, I'll just add.
Yeah, Dr. Hashmi, please.
Just to basically, I feel जैसे डॉक्टर साहब ने दो चार associations का नाम लिया, इसमें एक बस one association I would like to add, which I find is a more global association in terms of Pakistani healthcare, is the Pakistan Medical Association, which is again an association that technically deals with every single doctor in the country, and it has countrywide presence. And maybe the government can actually, in conjunction with the Pakistan Medical Association, bring people to talk to the general public. By general public, I mean the healthcare sector participants, managers, senior leadership. Bring people from institutions that are using this management and share their success stories. Because I think that in that way, a lot of the times, hospitals, doctors, clinics, polyclinics, they can relate to them and say, यार हमारे यहाँ भी यही होता है, इसका मतलब है हम भी शायद ये कर लें. So I think it's a matter of motivating them to go for the change and using a platform as wide as possible. But I think at some point or the other, the government support will also have to be there. That is very important because this is, it is a responsibility also, and it is their ethical responsibility also, because जिस तरह से कई जगह treatment हो रहा है, we all know really it's really not on, and it should change, and it inshallah will change. Thank you.
Thank you very much. This will be it from our side. I will now formally close this session with a token of thanks from the panelists. And to the panelists from IBA Karachi, from all the audience. And I really thank the attendees for again taking out time and listening to us. Listening to our panelists on this area. One good news is that IBA Karachi is already, certainly we have a program running, which is a PGD in healthcare management. But we are going to initiate a number of certifications, certificate level courses in the healthcare delivery systems, in again, quality management systems for healthcare systems, in information systems, for example, HMIS, healthcare management information systems, for example. So this is an agenda because other institutions are certainly going to do some things like Dr. Kidwai and Dr. Uzair Hashmi has already built an agenda for them. For IBA Karachi, this is our agenda. We'll work on it and eventually come back to you. Thank you very much again. Stay safe. And stay safe, from my side. Assalamu alaikum.
Thank you, Ramiz. Thank you, Zair. Okay, Allah Hafiz.
Thank you, Doctor.
Allah Hafiz.